Okay, now we're going to talk about supplements. I think it is impossible to get the nutrients we need from the best of food. And the reason I think that is because I keep trying to convince myself that it's not true. And I will go a few weeks without any supplements. I probably shouldn't admit that to anybody here because we're trying to get you all to take your supplements. And the feedback I'm getting is that first month, I can't believe how many pills I'm taking. I've never eaten this many pills, and I can't stand it. Well, I can't either. That's why every few months I say, I don't like taking all these things, and I don't. And a week or two later, I can tell a difference. And I'm thinking, I've done this for 5 years, I've done this for 7 years. There should be a time when I can't tell a difference. I should be able to replenish all the vitamins and minerals that I have, that I'm taking these supplements for, and they should be able to maintain because I'm eating good food. But guaranteed, 2 to 3 weeks later or a month later, I'm not feeling as well. The energy has dropped. My mind isn't as clear. And I take the supplements and it comes back. And I've done it 5 times in the last 7 years. I know my body cannot work without supplements, with the best of food. So, I don't think any of us can get the nutrients we need even with the best of food. The soil depletion of the micronutrients, early harvesting so that it can get 2,000 miles across the country to be delivered in our stores, increased exposure in the environment and with the other. Our goal is to get optimal nutrition, not to do the RDA. Recommended daily allowances are so far below what most of us need that it is pathetic. The 60 milligrams of vitamin C will prevent scurvy, if that's your goal, but it will not improve the immune system. It is probably not enough to get into the bones for healing to take place, to get into the connective tissue that needs vitamin C in order for connective tissue to repair itself. So we want optimal nutrition. I didn't put multivitamin, I put potent multivitamin. Most one-a-days have the following problem. A one-a-day is better than none a day. Everybody needs to recognize that. But there's about 4 or 5 things in a one-a-day that is fairly appropriate and all the others are low. The low are these. Calcium and magnesium cannot be high in a one-a-day because they take up too much space. That's why you need 6 a day, because of all the calcium and magnesium. And zinc, but they usually put almost enough zinc in there. But the calcium, magnesium, and the B vitamins, they do the RDA. You go over to the site and it says 100% of the B vitamins are in the recommended daily allowance. That's 1.7 milligrams. We put 25 milligrams. That's what most of us need, 25 milligrams of those substances, of those B vitamins, and not 1.7 milligrams. And sometimes they have really impressive 200% of the RDA. That means it's 3.4 milligrams. That's still way too low. So a potent multivitamin. We need to have essential fatty acids. We've got to get them from somewhere. If you're really with the fish, you can get your omega-3s, but you've got to get into the borage oil, evening primrose oil, something to bring in the omega-6 oils. I think that I have a bias in favor of vitamin C, and I try to get everybody. I think there's plenty of evidence that we should all be taking 1,000 milligrams a day, and that's more than the 60 milligrams that's in your, the typical one-a-day multivitamin. I think that there is soft evidence that we should be having more than that, and I try to put people on closer to 4 milligrams a day, 4 grams a day. Vitamin E, especially after the age of 50, more oxidation, more free radicals. People that exercise a lot should have extra antioxidants. I would add extra vitamin E. But I don't put extra vitamin E because usually there's 400 international units in your multiple. Magnesium, it's easier to get good calcium from food than it is to get good magnesium from food. And I think magnesium is just as important or more important than calcium. Magnesium is the mineral that is used in more biochemical reactions than any other vitamin or mineral in the body. You look on the big chart at the biochemistry reactions and you look, where's magnesium in all of these enzymes? Magnesium appears more than any other vitamin or mineral. If we want our cells to function, we need magnesium. So I add a little extra magnesium. After those basics right there, then there really is an individual program for each need. Some nutrients, we use nutrients in our office for therapy, not just for nutrition. And we can do, the lecture in November is going to be a fascinating lecture. It's entitled, There Are Alternatives to Drugs, There Are Healthy Alternatives to Drugs and Surgery. And we are going to go through the content showing what standard medicine does and what complementary medicine does, and how in many cases alternative medicine has better things, more effective, and of course far fewer side effects than what's available in standard medicine. But we use these for therapies.